Now to Olivia Newton-John. You know, she's opening up in a candid interview about her cancer battle and recovery, revealing she had so much pain at some point she couldn't walk. She sought relief with medical marijuana. ABC's Deborah Roberts here with the story. Good morning, Deborah.
Good morning, George. So many people touched by her raw honesty this morning. Since she was diagnosed with breast cancer back in 1992, Olivia Newton-John has publicly shared her struggles and her victories. And now with the battle intensifying, she's revealing the hard truths about living with this ravaging disease. She rose to fame as the original Sandra Dee, solidifying her stardom as a singer with hits like Let's Get Physical. But this morning, the actress and singer making headlines for her candor about her second battle with cancer and how she's coping with the pain and keeping spirits up for herself and fellow survivors. Opening up in a new interview with Australia's 60 Minutes, Newton-John revealing the pain was so bad she couldn't even walk at times, and that she treated it with marijuana grown by her husband, John Easterling. Telling the program, the pain level was really the hardest thing. I was trying to do shows, and it was pretty agonizing. After surviving breast cancer with chemotherapy treatments and a partial mastectomy back in 1992, the 68-year-old singer took to Facebook in May to reveal that her cancer had returned, writing that what she thought was back pain turned out to be breast cancer that has metastasized. But after a course of radiation therapy, marijuana use, and other natural wellness treatments, Newton-John says she's finally on the mend. I can walk, but I can't go long distances. But I'll get there because I couldn't walk at all a month or so ago. As I heal, I'll be able to walk more. Ever upbeat and positive, Newton-John reflecting on her life in that 60 Minutes interview. I've had and am having an amazing life, so I have no complaints. We all have something we need to go through in life, and this has been my challenge. The pain may be slowing her body, but certainly not her spirit. Olivia just performed last Friday at her namesake art center, and get this, she's planning to give it her all in a cancer walk this weekend. Steely determination, even with all that pain. She told 60 Minutes in that interview, I need to get through this. I have lots to do, but of course it's scary. I'd be lying if I said it wasn't scary, but I felt that this was something I could get through. George?
Oh, Deborah, honest and strong right there. Here with Dr. Jen Ashton right now. You see her mix and match a lot of different treatments for this cancer.
Well, I mean, first of all, when you talk about metastatic cancer, really of any type, when you talk about metastatic breast cancer, there are more people living with metastatic breast cancer today than ever before, which is a good thing, but it's not such a good thing. We wish that that wasn't the case at all, and we had a better cure for the disease. But when you talk about how you manage those symptoms, you heard her address it a little bit. It's really about the goal. You want to prevent further spread in some cases. When that's not possible, you do want to manage the symptoms. And when you talk about cancer that's spread, those symptoms will be determined on what site of the body they spread to. When you talk about metastatic to the bone, that is excruciatingly painful. Anyone who's suffered just a broken bone knows that pain. Imagine that times a million.
And for her, this homegrown marijuana really made a difference.
Yeah.
Is that for everyone?
Well, that's what I think is great about this. Again, we have another public figure shedding light on something that needs a lot more attention. And even though there have been studies out 7-10 years about the use of medical marijuana for treating chronic pain, we are still in our infancy. So there are a lot more questions now than answers. It appears that one of the compounds, a cannabinoid compound, targets a particular receptor in the body that is involved in pain. And we need more research in that. We also need more research to know what strains of marijuana are best for certain pain. What dose, what route? Do you inhale it? Do you ingest it? I mean, if you want to use this like a drug, you have to really study it like a drug, no differently than something pharmaceutical.
And what's the most important thing for people to know about treating metastatic cancer?
I think it has to be a combined approach, not just the patient, but their entire circle, the caregivers also, so you support them so they can support the patient.
Jen Ashton, thanks very much.